I'm Joy Pullmann. I'm the executive editor of the Federalist. Welcome to another edition of the Federalist Radio Hour. Today I have with me two of three co-authors of a brand new book. Jay Richards and William Briggs are two of the three co-authors of the new The Price of Panic: How the Tyranny of Experts Turned a Pandemic into a Catastrophe. Richards is a research assistant professor at the Catholic University of America and an author of a number of books and a senior fellow at the Discovery Institute. Dr. Briggs holds a PhD in statistics from Cornell University. He is the author of Uncertainty, the Soul of Modeling, Probability, and Statistics, and the author or co-author of more than 100 scientific papers. And their co-author, Douglas Axe, is the Maxwell Professor of Molecular Biology at Biola University, and he's been also published in scientific journals as part of his profession. So gentlemen, welcome. Thank you for joining me today.
Thank you, Joy. Great to be with you.
So while I was reading your book, I just took down a number of quotes from it. So I'm going to read a number of them back to you and have you expand and respond to them. So I wanted to start with this one, which is, as far as historic pandemics go, the coronavirus was unremarkable. What was remarkable is how we reacted. The 2009 swine flu pandemic, which killed between 152,000 and 575,000, as much as 0.009% of the world population, caused no panic. By the end of May 2020, COVID-19 might have claimed about as many as the swine flu. The press covered the swine flu, but there was no worldwide panic. Perhaps it was social media that made the difference, or perhaps it was the media's very different attitudes toward the occupants in the White House in 2009 and 2020. Tell me a bit more about this. You very often in the book say things that are contradict I would say the dominant kind of narrative about, COVID, about the pandemic.
Yep.
And this is one of them. First of all, you're basically saying we've been through things that are similar, or comparable in magnitude in recent memory, but we haven't reacted like this. What explains the difference in reactions between what we're going through still right now and other comparable, events that might be compared to it fairly, and they're in the ballpark?
Yeah, it's a great question. In fact, all of us brought something different to this book. And in fact, William Briggs, it goes by Matt, my co-author, is the statistical guru. And so he did some amazing work comparing past pandemics. So, 2009 swine flu, but kind of more relevant would be the Asian flu and the Hong Kong flu in 1958 and 1968, respectively, which are sort of on the magnitude of deaths. If you count all the deaths associated with the coronavirus as actual deaths, they're sort of in that magnitude, and yet there's no panic. And so we think it was actually a kind of confluence of factors. One, at least in the United States, was an adversarial relationship between the media and the president, so that absolutely everything that President Trump did, the media just took the opposite side. So in January, when he limited travel to China, he was a xenophobe, right, and a racist. When he advised lockdowns in March, then it was sort of too little, too late. And so really nothing that he could do, was praiseworthy, even if he was doing what the kind of official wisdom said at the time. But that's, of course, in some ways, that's only the domestic reality, because it was also a global reality. And we think it was a combination of what we call the tyranny of experts. So essentially a few public health officials that are well placed around the world, starting with the Director General of the World Health Organization, Director General Tedros from Ethiopia, and then in the United States, people like Dr. Anthony Fauci, who in a normal situation would be one of a number of sort of technical advisors to presidents or to prime ministers. And then those elected officials would have to weigh their advice against others. But in this case, what happened is that these figures, by the force of media attention, became these infallible oracles. So that all of a sudden, Anthony Fauci is a household name. Nobody knew who he was until a few months ago. That tells you something different is happening. So that you have these, they weren't speaking for science itself. Science doesn't speak in a single voice. They were government officials that, in the case of Anthony Fauci, President Trump had inherited, of course, as part of the kind of permanent state, the career state that's here in Washington. But instead of being an advisor that was one of many advisors, and then he could sort of use his prudential judgment to assess the various factors that need to be taken account of, they became these infallible oracles. And so the media itself elevated them. And then what we didn't have in 2009 that we really do have in 2020 is the power of social media and smartphones. Those existed, of course, in 2009, but they're orders of magnitude more powerful now, so that as a result, you could have a high, extremely rare outlier event, like the 7th standard deviation, just something that almost never happens. An old man happens to fall over and die on the street in China. Somebody records it, they upload it to Instagram, and 45 minutes later, it's on CNN, and the whole world thinks this is a representative event. So that really, we think the story, we're dealing with a fairly unremarkable coronavirus or an infectious agent. It's real. It kills people. We're not denying that, but it's fairly unremarkable historically. And then a historic social contagion. That's what we think ultimately the story of 2020 is about.
Not only that, these things are so common. We get them this is Matt Briggs here. My video is not working, but we get these things every 10 to 20 years. In 2009, these same experts, it's not well recalled, but many of them did try to start a panic, especially in England and the like. They did try to institute lockdowns and put out warnings and dire warnings and predictions of vast amounts of deaths, but they really weren't heeded. And another thing that changed between 2009 and then is the increase in globalization. Everybody seemed to take the lead, or not everybody, but many countries took the lead of the United States, and few countries did not panic. And so what we really want to do with this book too is to avoid the mistakes we made in this one when we get the next one, which will surely come. I mean, these things are as regular and predictable as pneumonia and flu peaking every winter.
So what would you say, well, actually, you mentioning that, Dr. Briggs, has me remembering a part of your book where you talk about the overwhelming kind of the disparate media reaction to an event and the actual reality. So the one I'm thinking of is it Zika virus or Zika virus? Because I was pregnant at the time and they were talking about how it would basically eat your baby's brains. And that's not even an exaggeration of what they were saying it could do, and women were getting, that friends of mine who were pregnant or about, maybe thinking about getting pregnant, were getting this vaccination, staying home, trying to avoid this virus. And I think, in the book, it's something, it's either, in the 50 to 70, 50, to 70, if I remember the number correctly, it's one of those two. That was how many people actually ended up dying from that, and so, so, I mean, now that you mention it, I have, and there's all kinds of instances of, some photo going viral on social media or CNN or whatever, and then everyone acting like this problem all of a sudden needs attention when maybe it's been there for 50 years or whatever the case may be. But there's a huge disparate reaction, between, the media. We say if it bleeds, it leads, so everyone knows that's a thing. But, again, like you pointed out, in previous instances when we already did have an inflated media reaction to a certain, small event, we didn't shut down the entire globe. So how do we get from, that being, everyone's used to, media trying to sell papers and stuff, and maybe people, so how do we get from that just being kind of like a little bubble to this being, a massive explosion in the terms of the response to it?
There's no one answer to this. I mean, the increase in social media is one thing, globalization is another. And in this case, because of the social media and everything, it wasn't just governments saying, we have to lock down, we have to stick everybody in, cram everybody into their houses, close businesses down, do all that kind of stuff. But citizens themselves were demanding this. They were demanding the protection. They had seen these images come out of China and elsewhere, and people panicked. And the panic spread like wildfire. And even now, you have these mask fanatics who are running around screaming at people for not wearing masks and all this kind of thing. Sure that they're spreading death and destruction wherever they walk. This is just one of these panics, a madness of crowds kind of thing that was made easier by
Holland, like the Salem witch trials, are, you're saying the contagion effect is kind of one of those sorts of human, dynamics was at play here?
Absolutely. Absolutely. And
Yeah.
the only way to get out of this
mean,
is to just for people to be distracted into something else. That's the main thing. The panic, the level of panic now has not subsided. And maybe you'll come to this later, but that's for other statistical reasons. But the government officials need to get out there and calm people down. But you can't say it. No one wants to say, just calm down. This is something that happens every now and then, because politicians have become acutely sensitive to that. They then would be blamed for causing deaths as if they had anything to do with it. So everybody is really skittish and worried and going towards the worst case scenario as a matter of policy.
I was going to ask you about the what we're talking about here, how much that relates to Twitter. So, I mean, we've noticed, especially since the Trump presidency, the huge distance between the Twitter conversation and, normal people. So I live in flyover country. I'm out in the Midwest. Almost, so the whole entire media cycle can be about something for months on end, such as impeachment, Russiagate, this, that, or the other. And it can have been major news for 3 months, and then you talk to like a grocery cashier, somebody in town, some mom at the park with their kids, they've never heard of it. That happens all the time to me.
Yeah.
So to what extent do you, what role would you say that media, as in news media, but also like the social media, played in creating the coronavirus effect? Jay, you want to take that one first?
I think maybe Jay locked up on us there. That definitely, that had a huge thing. It was not a matter necessarily of left versus right in this thing, because I remember when all those images coming out of China, people, they were spraying the streets with some mysterious substance, and people are thinking, "Oh my dear Lord, what could that possibly be? This is the end of the world." And everybody kept saying, "Oh, here we go." And then because of the social media, every new death was reported. Every time there was a new death anywhere, it was reported instantly. And every accumulation of a new death somewhere was put up in the media. And it became sort of a joke. And I think you could still do this. You could go into Google and type any 3-digit number and say coronavirus deaths, and you will find a dozen headlines from newspapers all over the place showing the reporting of these numbers of deaths. And because every single new death was reported, and the reason for that is that a lot of the news, as you well know, has become sort of algorithmic. These things are just fed into systems, and these systems propagate all this stuff, and everybody looks at this stuff, and then they start. It's just a panic, and
so are you maybe even applying that, like Google and Twitter's algorithms have a multiplying effect on social contagions like these? Possibly. I'm just spitballing here.
They do, but they absolutely do, because what they, the part of the algorithms that bump up search results is the number of links that people make to particular stories. And of course, everybody on social media is linking this. It's all over Facebook, Instagram, Snapchat, on and on. All of these things have exploded in use since 2009. So everybody was talking about this.
It's kind of like this feedback loop. Jay, we're talking about the media and how social media kind of amplifies the social contagion effect. And let me ask you something that's related to this, which is you talk about something that I think is very deep and very important about how this all ties into American world foreign policy, about our national security, because you make the point in your book in a couple of different places that now America's enemies know exactly the kind of the psychology and the social psychology of Americans, and what they can do to basically cripple us for. I mean, we're going to have economic and social repercussions of COVID for the rest of my lifetime. I'm 30.
Absolutely. Yeah,
so
there's no doubt in my mind.
More about that foreign enemies, the advantage that our response gives to, and how it damages our national security for decades to come.
Well, it does, because I think the assumption outside the United States, our own self-understanding as Americans, is that we're liberty lovers. And so there's things, there's these sort of stereotypes that well, there's things maybe in East Asian countries, they tolerate a more centralized government and more social control. And we sometimes say that as Americans to sort of justify despotism in places like China. But we have this sense that there's something sort of intrinsically American about this love of liberty. And yet what actually happened? Well, if we had been told by the president, for instance, imagine President Trump had come out in March and said, well, we've decided that it's really just for your own good to stay inside. It's just not good for people to be outside, right? I mean, the right would have gone crazy talking about the First Amendment. Libertarians would have had a fit. The left would have talked about fascism, right? We would not have stood for that. And now just change the scenario. There's an infectious agent, and if you go outside, you could kill people. You go to church, you might breathe on an old man and kill him, right? So that's a kind of a moral jujitsu in which they use our own legitimate concern for our fellow human beings and our fellow Americans against us, because we don't want to do that. Who wants to be the person that caused someone else to get sick and they died, even though you didn't even know you were symptomatic? And so in some ways, I wouldn't say, okay, somebody figured this out ahead of time. Right. Rather, this just sort of happened for various complicated reasons having to do with the incentives of government and public health agencies and so forth. Now everyone knows, right? We did not immediately rise up and march in the streets. We complied. In fact, here we are 7 months later. I'm in suburban Washington, D.C., and almost everyone is not only complying, they're still spontaneously and individually enforcing it upon everyone else. That's information. That's information about the American psyche. It's information about the ways in which media and social media can be manipulated to control us in the future. And I think that's a cost that we really need to reckon with.
And here's something that you wrote in the book that is related to this, that says, this is a very interesting thought experiment that I think it is really interesting to contemplate, a little scary. You write, imagine that you were subject to a global campaign of psychological warfare. And we know this happens all the time. PSYOPs is absolutely a thing that foreign governments use. I mean, if you were a Russia collusion believer, you believe that already.
Right. That's right.
So, and you say every source of information seemed to confirm the same frightening story and to appeal to the instinct for fear buried deep in your soul. But it was all misleading you. How could you tell? So I think that's a very interesting question. How could you, if you look at everything that we did, where is the dynamic that says, wait a second, I need some better data before we do something this extreme. What is the gut check? Well, we don't have a gut check. Well, right. If you don't have any barrier to being taken in by PSYOPs by Russia or China or North Korea or whoever, then we have
CNN.
Cultural problems.
We do. And that's the dilemma, because this is the thing about the madness of crowds. It's really easy to tell it and to recognize it after the fact. That's why we talk about the Dutch tulip panic and we talk about the Salem witch trials, right? Because we're not in them. We're not inside the dynamic. In 2020, we're inside the dynamic, and certain people figured it out early on. Now, some people, honestly, I think it's because they were conspiratorial and they just sort of think that way. And it happened to be an adaptive thing in that scenario. I think in our case, Matt and Doug Axe and me, we were all really skeptical about predictive models. And so I honestly think Matt is an expert in this and has been doing this for years. And once we realized, oh my, this is not based on data. This infection fatality rate that the Imperial College in London assumed, 3.5% infection fatality rate, that was based on basically no data. It was some airplane information of flights coming out of Wuhan, really just basically an assumption in the model. And all of a sudden, we're going to change the global economy. Overnight, we're going to shut it down, not on data, but on a predictive model. And so that was, for us, that happened to be, sort of red pill that allowed us to see, okay, this is possibly really catastrophic. And it was other things for other people. But I think it's the sort of thing we need to look back on it and say, how am I going to be able to tell next time when this is just all the information is coming from every direction? It's like being in the Matrix, right? You're going to notice that little glitch in your visual field, or you're going to explain it away.
Yeah. Do you want to, Dr. Briggs, start talking about some of the work that you do in you do in this book about what's wrong, what was wrong with the models? I mean, there's a lot there, but so if you're talking to a lay audience, we're not statisticians. So
Sure.
so like you're out, you're with your friends over the dinner table, and they say, "Explain to me the models." Give us the highlights of that your book goes into greater depth to what was wrong with those models from the outset, and that was, I mean, as your book says, readily apparent to anyone who actually knew anything about statistics or modeling.
Well, the Imperial College model, that's what kind of panicked everybody
Mhm.
in the intellectual circles anyway. They ran a simulation based on all kinds of just supposeds and guesses and all this kind of thing. And they put out numbers that were going to make this bug deadlier than the Spanish flu.
Uh-huh.
Maybe twice as deadly as the Spanish flu. The Spanish flu killed up to 50 million people in 1917, at a time, of course, when
Yeah.
medicine was not nearly as advanced. 100 years ago, medicine wasn't nearly what it is right now. There were all kinds of mistakes made back then that we're not making now. And the numbers were absolutely unbelievable. There was no way to believe these forecast numbers that they put out. But they put them out in such a way that they fooled themselves. They put them out in terms that weren't in real numbers, but in rates and things like this. And the rates seemed a little bit more plausible to them. But when you turn the rates into actual numbers, it was ridiculous. It made no
So you're
sense
saying
whatsoever.
they just predicted so many people dead that it was statistically highly unlikely that it could be this
Oh,
many
it was an absurd number to put out. I
Uh-huh.
mean, deadlier than the Spanish flu? We get these things every 10 to 20 years. How is this thing possibly deadlier than the Spanish flu? There was no indication coming out of China by the time they put this forecast out that the numbers were going to be anything like this, but they were believed. And not only that, the complicated thing to explain is they said, well, we can avoid all this and we can cut the numbers down by some margin if we invoke all this locking down stuff. But those were just assumptions that they had made and built into their models. And it's a very technical thing to say and difficult to get people to understand, but no model of any kind says anything but what the modelers wanted to say. So in other words,
Oh,
they built into the model saying lockdown worked, and then they reported that the model said that lockdowns were working. And then they said that we should lock down because the model said lockdowns work. But that's an assumption they made going into the model. And
explain that a little bit more. I mean, so it seems to me like it's kind of like a computer program. The way that you structure it, it kind of guides it in the direction of the answer that you
it's
want
exactly right. That's exactly right. They said, let's put into the model that lockdowns work.
Oh.
And then they made a forecast saying the number of dead. They said, look, this number of dead is lower than the number without lockdowns. Now we're going to say to people, lockdowns work. Well, that was their assumption from the beginning. And the strange thing about this is it went against all of the evidence up to this point. People don't even know this, but the WHO, the World Health Organization, last year had a big paper on this saying, the next time we get one of these pandemics, here's what we should not do, lockdown. This was in this paper, and the WHO immediately forgot that they had written this stuff, and this Tedros guy, who is the boss of the WHO, running around looking for publicity more than anything, I think, starts contradicting their own scientists and so forth. And latterly, only lately, I guess it was this week or late last week, another WHO official said, you know what, maybe lockdowns aren't such a great idea after all. They're reverting back to their original evidence. So all of this stuff was just thrown under the bus, which specialist experts, other experts who were not involved in any of the decision making, everybody knew this. This is not like the stuff I'm talking about is not arcane, bizarre knowledge that that nobody knew. Lots of people knew this. Everyday epidemiologists knew the stuff that we were talking about. But for some reason, in 2020, all of these experts pretended to forget all they knew about viruses and were just going along with the political flow.
Why do you think they did that? I mean, that's completely irrational, right?
It is irrational, and I think, but I mean, you saw it today. I mean, when we're recording, I noticed just a few hours ago, before we did this interview, Jake Tapper was saying, well, President Trump is down in Florida, and he's, conducting another one of his rallies. It's his first big public rally since he got out of the hospital, and he is contradicting the nation's leading expert on this topic. Well, he's talking about Anthony Fauci, and so the idea is that if you're a government official, somehow that's a gold medal, like there's this ranking of scientific expertise. And the guy that happens to work for the federal government, he's the top one. That's not how science works. There are lots of smart epidemiologists and immunologists and modelers at Stanford and Harvard and Yale and Oxford that were saying from the very beginning, this doesn't make any sense. Unfortunately, as Matt said, they didn't have access to the policymakers. What we have is this really is a tyranny of experts. You have people that are in the kind of permanent career state, public health officials, and for good or bad, when something happens, they're the ones that have the ear of the president. That's actually the real problem. And then when those individuals, rather than being anonymous advisors, are elevated by the media, you get the kind of toxic brew that we encountered in 2020.
Let me add that. If you're a bureaucrat and all of a sudden the media is swarming around you and you say, here's what you're not going to say. You know what? Our office isn't really that important. You don't really need us. If everybody just calms down and relaxes, everything will be fine. That's just not going to happen. If you're going to go to these guys saying, what can you tell us? We need to look to you. And these people let it go to their head in large. And Fauci, he flip-flops more than a perch thrown on a dock. He switches his mind about his opinions about these things often. And we document some of these cases. It's just being driven by a political force at this point, much more than any kind of evidentiary basis for all this. And that's what we have to really look out for.
Can you tell me more about, explain what is wrong and explain how initially the concept of flatten the curve itself has problems, and then how and then you do two things. You do that, the concept itself has problems. And then second of all, the concept morphed and changed in the media narrative over time to encompass even more problems. So can you talk about the flatten the curve, the idea that we were sold, I think, to get into the lockdowns, and that, have been ever since used as a reason to keep us here?
Yeah, Matt, take that. That's a Matt question.
I thought that, yeah. Okay. Well, the idea was we had 15 days, I think it was, or I forgot the exact number. It's always 2 weeks. It's always been 2 weeks. It's been
more
2
than
weeks now for
hundreds
months.
of days ago now.
Yeah, it was 2 weeks to flatten the curve, and all of a sudden this was going to minimize a certain number of hospitalizations. Everybody looked at these numbers of beds that we had, and based on models, they said, here's how many people we're going to need. And so based on models, again, if we lock down, we're not going to need as many, and we're going to be able to flatten this curve and handle the big rush of all the bodies that are going to be coming through the hospital. And as you know, based on these things, this singular measure, when of course health is nothing like a singular measure, there's all kinds of behavioral things that feed into health. There's all kinds of ways to treat people other than just hospitalizations. And it turned out, and not unexpectedly, that this disease did not require intense treatment for most people, although the initial reports during that flatten the curve seemed to indicate that. The big story was on ventilators. Everybody had to be hooked up to a ventilator.
Yeah.
GM was tasked to start building ventilators. Yep. And every image you saw, exacerbated this thing. Well, hospital ships were brought into New York, which remained completely empty. The curve was flattened just naturally. Everybody started staying away from hospitals, even the sick. And this is a very bad thing. So this flattened the curve did the opposite case. There were a lot of people whose illnesses got worse. Many people died not getting the treatment that they were going to get because they were so terrified of going to the hospital, or they were turned away at hospitals waiting for this immense rush of bodies that never came, that just never came. And so the whole thing was, it was the wrong approach from the beginning. It's not
And
necessarily
because
wrong to use models, but
it assumes a static number of people who will be harmed by the pandemic. When you're saying
Well,
because people, I mean, human society is an ecosystem.
yeah,
When one part
right.
changes, the other changes all in response. It sets off this kind of cascade of changes. So there was never going to be just a static number of X deaths that will happen, and we just move that from all happening at one time where our hospitals can't handle it to overtime so the hospitals can handle it. But you were saying that was never true from the beginning because of this ecosystem effect.
Yeah, exactly. And I mean, even more simply, if you look at the flatten the curve image that all of us saw, both curves, right? There's the short spiky curve that we thought would, okay, that's the scenario where we outstrip hospital capacity. So you have a lot of people dying, but you have excess deaths because they can't get treated, right? And so the idea is that you flatten these, slow things down, but notice it's the same area under the curve. So the same number of people are going to catch it in either case, the same number of people are going to die and need hospitalization. We'll just spread it out. And so the idea is we'd save lives for that reason. But notice that the whole point with the 15 days to flatten the curve was that at best, we could maybe buy ourselves a little time. We're never going to be able to lock down society and prevent the virus from spreading. 2 weeks later, all of a sudden, now we're locking down to prevent it from spreading. And here we are 7 months later. No experts thought that you could ultimately lock down sufficiently to be able to stop the spread. And so the argument changed within 2 weeks, and almost no one noticed, unfortunately.
Well, and it switched, as you note in the book, it switched from deaths or hospital capacity to simply a positive test, results. Which, I mean, so at this point, I now know a number of people who have gotten coronavirus, and some of them don't even know they had it. I mean, and we know that statistically happens for a very large number of people, 30, 40%, possibly more.
Right.
Right. So again, I mean, there's kind of another deception. I was talking to another friend, a couple days ago I go out to dinner parties. Well, that's what I was doing. And she was saying to me this, the number one word that she thinks of when she thinks of coronavirus is deception, dishonesty. There's just so much and so much of that dynamic in every bit of it, and I think that's one of the biggest one is I'm trying to think of a nice word for behind covering.
Right.
When you
No, it's a CYA effect. Absolutely.
Yes.
And I mean, the weird thing about the cases is that people often don't realize is that the number of cases now, or what are being called cases, are largely an artifact of us doing so much testing. And so, months ago, what a case meant was someone that had symptoms they're bad enough they had to go to the hospital, right? You test them, they test positive for the virus, that's a case. Well, now we're testing hundreds of thousands of people every single day, most of them asymptomatic.
It's up to about a million per day.
Wow.
1 million per day, several times just in the month of September. When you're doing that, a lot of those people are already asymptomatic. They're just being told, go get tested. It's a positive case, but it doesn't really tell you anything. And that's what's so weird. Even the very definition of what a case has meant has actually changed over the course of 2020. And the media themselves who do it don't even realize that they're using the words with different meanings over time.
Right.
Yes, I want to reemphasize that, because this is now what is driving the continued panic. The testing is going up, 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 and up. We are now averaging over 1 million tests a day. It's not slowing down. It's happening in most states. And even if the virus is completely eradicated, which it's never going to be, but even if the virus is completely eradicated, just because of false positives, we would still be reporting these so-called new cases every single day, and they would seem to be increasing. They're not cases at all. This is, as Jay said, this is one of my sticking points. But up until 2019, in all of medicine, a case was somebody who required treatment, and now a case is any kind of positive test. I mean, we used to speak in the literature of case fatality rates versus infection fatality rates versus population fatality rates. Now it's all the same, and no one can keep these things straight. They would mix up case fatality rates with infection fatality rates, and these are usually much different, of an order of 10 times more or more different. And then they let themselves build these things into models. So even people who knew better were making the mistakes. They got swept up into this, and it's really inexcusable.
Because I'm sitting here thinking, if if I get a positive result and don't feel anything, should the entire, I mean, how many, I don't know, it's and all, I don't think I'm articulating what I mean, but the disconnect between the actual encounter with the disease, now that's hit my more rural area, and the response to the disease, I mean, I've heard of people, like feeling like they have a death sentence if they get a positive test. And then,
yeah.
Looked at the CDC data just recently. I wrote an article, I think, a week or two, when the CDC's best estimate says that, for people under 70, it's like 99% of them are, more than 99% will not die.
Way more than that. No, that's right. It's more like, yeah, and what's funny about this, and that's what's so strange about it, Joy, is that for the last several months, if statistics could affect you emotionally, all you had to do was look at the CDC website. It wasn't like this is not esoteric knowledge. I would always just tell people, just look at the actual numbers at the CDC website. It might take you a few minutes. And turns out, if you're under 50 or you have kids that are 14 years old and they're healthy, there's like a 1 in a million chance that they're going to be endangered by this. Way more likely that they're going to get severely sick with the flu.
In a car accident on their way to the testing site, then
absolutely. And so, and it's not like we've known this for several months. That's what's so strange about it. But that's why that's the reality of a social contagion, is that it's sort of immune to refutation. And then the question is, okay, so how do these end? Matt said earlier, well, it may be that we just need something else to pay attention to, but of course we have an election and that doesn't seem to be doing it. And it may be because they're sort of mutually implicated, but at some point, I mean, we're going to wear ourselves out with this thing.
Well, and one of the things I wanted to ask you about that is that I wonder if some of the disconnect is that because we have been artificially cushioned from the effects of the lockdown. So since for example, we're separated from each other, we can't see that our neighbor's little boy, is in the basement and she can't get him to come out, So I had an acquaintance, couldn't get her son, she had to pry him out of under his bed covers, And if you're not, if you're not around talking to people, hearing people, you're not hearing stuff like that. Or, for example, a lot of people are out of jobs, but if we're, sending checks to people for not working, they're not saying, excuse me, I need to work, I need to put food on the table, or, and there's, and you can give any number of 100 examples, people who now are finding out that their cancer is, 6 months more advanced because they put off a cancer, they had to put off a cancer screening. There's way less awareness, I think, right now of the costs of, it's maybe too comfortable to be in our homes with our Netflix, with Amazon delivering us, our necessary supplies.
Or at least it's too comfortable for those of us who get to talk for a living and get to influence others. And so, I mean, the three of us here, right? I mean, frankly, we, what we did with the time that we saved from commutes and trips, we wrote a book, right? That was sort of extra time that we had, right? You worked for the Federalist, we write. Right. We're part of the digital economy. And so those of us that are, do this kind of thing, we're not suffering. It's the people who have a family Mexican restaurant, right? Who don't actually have a voice, who just had their life savings and their life work just destroyed, right? We don't hear from them. They're kind of off the radar. Those are the people
like that. They are livid, I mean,
absolutely.
They act like you just shot their child, which if you've ever built a business, it is like your child, I mean, obviously I think human life, but it is very emotionally deep and compelling. And most people, we don't have that experience of doing that. So we don't know how deeply and visceral it is to take away half of the life that they spent creating that.
That's right. And that's why I honestly think there's going to be a reckoning at some point. I mean, I think I really think we show in the book that the lockdowns, not only did the lockdowns, it's not just that the cost was greater than the gain. The government lockdowns probably didn't have they certainly had no detectable effects on case curves or death curves. Matt, why don't you take that?
Sure. I mean, there were several countries that did not lock down. Everybody focuses on Sweden, but they forget Japan. Japan has, 10 times as many people, more than 10 times as many people as Sweden. They did fine. In fact, I think their death rate per million is about half that of Sweden. They never locked down. Taiwan never locked down. They never closed any. They closed the schools for a week, 2 weeks, something like this at the very beginning when, information was sparse, and then no lockdowns. And Asia seemed to handle it better than countries in the West, who reflexively went for the lockdowns. But in the United States, don't forget, there were 8 states that did not lock down: South Dakota, North Dakota, Arkansas, and so forth. And they have better death rates per million than the states that did lock down. And then the states that did lock down had terrible policies, like in New York and Connecticut, throwing the people who were ill into nursing homes, spreading the infection among the most vulnerable. This was listen, I tell this to people all the time. Why do we get the flu and pneumonia peak every January, February of every single year? It's because we self-impose our own lockdowns. We cram everybody inside houses because of the cold, and we spread these diseases around. And so the government hit on this idea. What's the best thing we could do? Let's lock everybody in their houses, except letting them out to exercise only one time. We can go on, we do go on and on about this in the book. I become so livid about this because there was no evidence in the beginning to suggest that lockdowns work. There's no evidence now that, because we did an analysis of different countries looking at the death rates for those that did lock down and those that did not. And if anything, there's probably no way to tell with any absolute certainty, but there's a slight edge to those countries that did not lock down. In other words, that was a better strategy to follow, letting this disease play its course amid, commonsensical sort of solutions, isolating the sick. That's what a quarantine was up until 2019. That's a wise thing to do. Protecting the absolute vulnerable people in nursing homes and things like that. That's a sensible thing to do. But to do it to entire populations under no evidence and against the direct recommendation of all evidence that we heretofore had, that's the real story.
Now, I'm hearing you say that, no evidence, the evidence is against it. We did this analysis and compared no lockdown regions and states with lockdowns regions and states. And that's exactly the opposite of what you hear. You hear all of the evidence, says we need to lock down. All of the evidence says, masks are good. All of the, the science says this. I am not an expert in, in infectious diseases. I am not a statistician. How are normal people like me supposed to hear, one group of people say, all the evidence says do this thing, and then another group of people say all the evidence says do this thing, and they're completely the opposite thing. How do you mediate as a normal person between that? How do you know who to trust?
Well, this is the danger of the tyranny of experts, right? Is that people genuinely, there are actual experts that are experts on highly specialized fields. But basically, our argument is that when you're going to make millions of people do something that they don't want to do, you need to be able to make the case so that they can comprehend it. And in this case, that wasn't done. And it's like I would say, the kind of most persuasive visual we have in the book on this point about the lack of effect of the lockdowns is we show the curves. So if you know what these look like, these curves in which you've got a number of cases or deaths, and they start out small, and you get this exponential growth, and then they level off, right? And then we know all the different states. We know where the government lockdowns happen, right? We've got the dates. And so what you'd expect, you'd say, okay, what would happen? How are we going to test whether the government lockdowns had an effect or not? Well, what you would expect is about 10 or 11 days after the lockdowns go into effect, you would see a curve downward on those case curves, right? So that you're basically seeing the signal among the noise, exactly. And so we lay that out in the book, and then we compare out all the states that locked down and then the ones that didn't. And I can tell you, Joy, that the curves look very, very similar for all of these states. And if you did not know where the date was when those individual states locked down, you'd never be able to guess it. So it's basically the best that we could say is that the coronavirus is just completely indifferent to these government interventions. Whatever benefit happened was almost certainly prior to that with the kind of voluntary social distancing that we all use. We do this all the time. You have local knowledge about your own dangers and what your normal situation is. And then these government imposed lockdowns were just sort of arbitrary efforts after the fact that had no discernible effect. And we now know were catastrophic, both in lives and dollars.
Same with masks too. Same with the mask mandates and criminalizing lack of masks, making it a crime, a brand new crime. really overstepping the bounds of government, good government. The evidence about masks is at best ambiguous. I mean, there's paper after paper in the literature up until this before 2020, most showing no effect whatsoever, and some there's a recent one coming out showing cloth masks in the British Medical Journal, came out last week, help spread disease. Wearing these things because they're just nasty. I mean, you're touching your mask. You think you've got on some kind of shield or something that's going to protect you from mysterious rays, and you're touching it, fiddling with it, doing everything, and that's not what surgeons do when they're in an operating room when they're wearing masks, which is mainly to keep them from coughing into the patient. You know, that kind of thing. So, but people just get these wrong ideas, and now they're absolutely certain positive truth about these ideas, and once they get them, really no amount of showing them the literature or evidence is really going to budge them.
That's and that actually that affects the fact that once people have locked into something, you know, especially something that seems to be so emotionally driven, and I think part of the reason that this is so emotionally driven is it has to do with death, right? And we don't want to, you know, people don't want to die. It's, you know, one of the deepest fears of humankind for all, you know, all history. But once they get it, it's calcified, and it's very, very difficult to, even if you could say, look, I will read the paper, you know, let's sit down for 2 hours. I'm a scientist. I'll read it with you. I'll explain it to you. You know, maybe you could persuade that one, but you can't do that. You know, 330 million Americans, all of whom should have a consent, you know, to the government that they live under. And so that's one of the reasons that all of that to say, I'm not sure if we will have a reckoning. So if you look, for example, at like the Russiagate hoax, you know, that was another massive hoax. You know, so far it's been, you know, it's been 4 years. We've had the evidence that it was a hoax since the Mueller report 2 years ago almost. You know, not seeing indictments. You know, we're not seeing. All these people are still on cable news, and you know, maybe say, okay, well, it's 2 years later, not 10. But you know, I'm kind of worried that the same thing's going to happen with this. And part of the reason is, you know, for example, again, to compare to the collusion hoax, half of Democrats still think that President Trump is a secret Russian agent. Half, 50%. You know, even though it was proven by their own star, Robert Mueller, that there's no evidence he could find to prove that. So I'm thinking with COVID, it's very likely, especially since we have this, you know, it's very shameful and difficult to have something that you clung so tightly to, you tied your very life to, you know, wearing a mask or whatever the case may be. I wish people would, you know, oh, in retrospect, I was wrong about that. But I don't know if that's going to be the case.
Well, I don't. The only way.
Let me say something. Jay thinks there's going to be a reckoning. I think there won't be. I think that next year you could look for Fauci to win the Nobel Peace Prize. Or something like this. This is too big a mistake to admit to have made. This is trillions of dollars and thousands and thousands of lives. You can't come out and say, I was wrong. The government's just not going to do that. So they're going to just keep at it and say, we were right. If we didn't do anything, many more would have died. That's the line they're going to stick to. And that's maybe Jay is right. I hope Jay is right, but I don't think.
Well, that's why, you know, it's honestly, that's. Yeah, we wrote the book in part because we want there to be a reckoning. I'm thinking more of a peasants with pitchforks kind of reckoning, though. I'm not expecting career public health officials necessarily to admit it, but the fact that the World Health Organization has itself already seen the winds are changing, right? And now they're now admitting that maybe lockdowns are not politically viable. And so I think, unlike the Russia collusion hoax, which is the people that it involves are ultimately a couple of hundred people. The lockdowns involve everyone, and there are tens of millions of people whose lives have been devastated by this. And so I can't help but think, I hope that at some point that we wake up from this, and that at least a majority of the population realizes, okay, this was a public policy and social contagion catastrophe. Let's not do that again.
I mean, to you know, counterexample, the Iraq War, but you know, that took 15, 20 years for public opinion to change on that. If you look at the polls, you know, near September 11th, you had 75% of Americans supported going into Iraq. But you know, again, so I mean, 15 years is a lot shorter. chance.
That's
We'll
about when
see.
the next pandemic is due, so maybe we'll remember this one.
Hopefully, we can learn our lesson before the next pandemic, for sure.
Well, if you want to learn more about the arguments and the evidence that are underlying the ideas that Jay Richards and William Briggs have been talking about today on the Federalist Radio Hour, you can read their brand new book. It's out this week. It's called The Price of Panic: How the Tyranny of Experts Turned a Pandemic into a Catastrophe. Gentlemen, thank you for speaking with me.
Thanks, Joy. Great to be with you.
My pleasure. Thanks for having us.
And to all of our listeners, be lovers of freedom and anxious for the fray.